Welcome to Rare Connection, the podcast that connects rare disease patients, caregivers, advocates, and medical professionals, because no one should navigate rare alone. I'm your host, Joanna, and in honor of Rare Disease Awareness Month, um, today's episode is about survival, advocacy, and the power of asking one life-saving question. My guest, Taylor, is a writer, performer, speaker, and patient advocate who nearly died after the birth of her daughter, when she developed a rare and devastating condition called atypical hemolytic uremic syndrome, also known as aHUS. What began as childbirth turned into multiple organ failure, weeks in the ICU. But miraculously, both Taylor and her daughter survived, and what Taylor learned during that experience reshaped not only how she approaches her own healthcare, but how she empowers others to advocate for themselves. You may have seen her viral Huffington Post article. I spent weeks near death in the ICU, asking my doctors to do this one thing that may have saved my life. Today, we're talking about what happened during the medical Today, we're talking about what happened during that medical emergency. The reality of rare disease misrecognition, the power of patient voice, living at the intersection of disability and motherhood, and how humor can coexist with trauma. Taylor, welcome to Rare Connection.
Thank you. Thank you so much for having me.
Can you walk us through what happened during the birth of your daughter?
Yeah, of course. Well, any birth has its own wild story. And I was full term with my baby, and she was a week late. And the doctor said, well, we got to induce. So I went in and, you do all the things, all the uncomfortable things that you have to do to induce a baby. And about a day and a half into that process, they alerted that her heart was showing signs of distress. And at that point, I was pretty tired. And I said, well, I don't want to take a risk. So my team and we all decided that we would do a C-section. I had what a doctor would call an unremarkable C-section, meaning that it went fine. Baby was born. She was what's called sunny side up, so it means she was a little backwards. And so when they pulled her out, they exclaimed she was a girl, because we didn't know if she was going to be a boy or a girl. We left it to be a surprise. And I didn't even get to see her, really. They really wanted to check her out and make sure she was okay. And it's sort of ironic. I spent sort of this whole process worried about her. Oh, sorry, I have a dog. She barks every once in a while. Just my house dragon. I was worried about her. I didn't give one iota of thought, really, to my own health in this process. I'd always been a pretty healthy person, and nothing flagged during the pregnancy that would be an issue. But while they were checking her out and they were giving me some time to rest, I had one nurse on me, and I just sort of started to set off alarms. And initially, she sort of looked and she was like, well, they're very sensitive. So she came over and she turned them off, and then she went back to her computer. And all I felt was very, very tired. And the alarms went off again. And I just remember her face sort of sink into realization that this was actually like an emergency situation. Suddenly I was swarmed by doctors and medical teams. And they used this sort of almost like an iPhone scanner over my abdomen, and immediately were like, we have to rush you into surgery. My husband, I just grabbed my husband's hand and just said, I love you. I didn't even get to see the baby at that point. They sent me back into the sort of theater, the operation room, and they put me under general anesthesia at that point. And what they discovered was I was bleeding, and they had no idea how and from where. And they spent much of the night trying to save my life. Luckily, they did. But that was only just the first domino in a series of extreme dominoes that were to fall after the birth of my baby. That birth then triggering a disease. That disease was eventually my diagnosis, called atypical hemolytic uremic syndrome. There is some debate, though. There's a team of doctors who would like to change it to mine would then be pregnancy-induced complement-mediated thrombotic microangiopathy. So none of those roll off the tongue very easily. And essentially, the disease is started by the complement system. It's a part of the body I didn't even know existed until all of this. It overreacted, and it is very tricky in that it it ate up my platelets and disrupted my blood in such a way that it not only caused a bleeding disorder, but also a clotting disorder at the same time. So a highly, highly violent and dramatic situation that led to multiple organ failure and a really challenging battle for survival.
So the signs of a stroke are be fast. It's balance, eyes, face, arms, speech, and time. In this case, we wouldn't have seen balance and probably not eyes either, because those are two for a normal stroke, but they have been added to the FAST acronym. And so they are normally tested for if you go in for a stroke. But the face will droop with a stroke. Sometimes your arms, you won't be able to lift them. Also, your speech, you'll talk like a drunk person. And lastly, time. And it's time to get to the hospital. So you have a limited amount of time to get to the hospital, where they can stop this inside the hospital if you get there quick enough. So it's always recommended that you call 911. When did doctors realize this was not a normal complication?
Well, I think when they realized that they could not figure out the source of the hemorrhaging, in that night, I think, not to say that hemorrhaging is, a commonality, but I could tell that my doctors knew by just the chaos of what was happening and the rapid nature of it. I think those were like profound signs that something deeply challenging was going wrong. That was probably the first sign. The second being my labs. I think there's a lot of things that can happen in birth. And mine also sort of resembled a few other situations that involve thrombotic microangiopathy or TMA or tiny blood clots. There's a condition called HELP that's more common that can present in this kind of way. But help usually resolves after the baby is born. And so I was not getting better. I was actually getting worse. I had a doctor look at my kidney labs and look at my um, blood labs and sort of say, it was actually my nephrologist who was like, something is very off with this patient. And luckily, that person flagged that a hematologist should get on board in my care. And luckily for me, that hematologist checks their messages, checked his messages on a Saturday morning or breakfast. I probably wouldn't be talking to you otherwise.
The miracle you're even alive.
It 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 is, and don't think I don't think I don't know it. I'm very lucky.
So did you need any kind of transplants?
Well, that's a good question. I am technically on a transplant list, but what happened to me was I had total kidney failure. I was on constant dialysis. If anyone's familiar with that, we're like you're not allowed off the machine. um, but luckily, I it was a long road. I eventually was able to do what we would call like outpatient dialysis, where you go to like a DaVita, and and after 9 months of medication and treatment, I am one of the 1 to 2% of people that was able to graduate from dialysis without a new kidney. So right now, I have over the past, gosh, 3 years, I still show very, very conservative, very slow, but predominant kidney healing, which is pretty um, honestly unheard of. Like it is also a miracle.
Oh. For listeners unfamiliar with atypical hemolytic uremic syndrome, what does it do to the body?
Yeah. Well, most people aren't familiar with it, so it's pretty much everyone. Um, the way I like to explain it is it all starts with this system I mentioned earlier, the complement system. Now, the complement system, not to get too into a biology lesson, uh, it's called the complement system because it complements your immune system. A lot of people mistaken this disease for autoimmune. It's sort of like an autoimmune disease is like cousin. It is part of the inherent immune system, but it's not technically autoimmune. But it is my body overreacting. So it's essentially this squad of protective. I sort of liken it to an offensive line on a football team. And they do, in a normal working body, a really great job at attacking bacteria. They sort of run together and they swamp a bacteria and neutralize it. In a normal working body, there's sort of refs that make sure you go like, oh, that's a normal cell. Don't mess with that. That's not. So let's get that one. In my body, when I gave birth, somehow the refs stopped working. So this like squad of football players decided to attack their own team, the stands, all the people, the refs, the everyone selling popcorn. They left the stadium and then they're attacking the public at large. So essentially, this squad just started attacking willy nilly my actual healthy cells.
What does multiple organ failure look like to a patient?
Doesn't look good. It looks pretty bad. Uh, it's for me, it was not waking up from anesthesia. It was a lot of time in the ICU. It was a lot of time on dialysis. It's very scary. It's very scary. And even recovery is not always very linear. So, you take 3 steps forward and 2 steps back all the time. Um, it's a frustrating, scary process that you don't know if you will survive. So, what does it look like? It looks it looks really scary. It looks I was, I mean, I we always had hope, obviously, that I would survive. I had sort of There were several times, where I was rushed to the ICU. I'd get better and get worse. Stop breathing or, have kidney like a uremic episode or, whatever. Like it was a roller coaster. It looks like a really scary roller coaster where you're not sure if at the end you're gonna actually get off the ride or
Wow.
tumble into the ocean and not make it ever back to the carnival.
That'd be scary for both you and your team of doctors.
I had a lot of doctors. I had about 20 doctors, and they really, yeah, they were scared. They were scared. I mean, lots of stories from my doctors about, they'd be driving home from work and getting an alert and having to turn around on the freeway, getting off the freeway, getting back on, going back to the hospital to help me. They were on the ride with me for sure.
What was the one thing you asked your doctors to do?
Well, when I was in the ICU the 3rd time in, like, t 2 to 3 weeks, I I was brought in a coma. They put me in a coma because they were just like, "We're gonna give this girl a timeout. She's really fighting, and it's really bad, and so maybe if we just put her in an induced coma, you know, we can get some more recovery." I know when they did that, like, one called my husband and was just like, "I don't know if we're putting her in this coma, and we're not sure if she's gonna come out." But when I did wake up from that coma, I would say I came back a bit of, like, a changed person. I felt like I was pretty passive in the experience up until that point. And I remember having all these doctors, and I tell you, like I said before, they were fighting for me, and I knew it. But I could also tell had been a project manager at work before, and I could also tell when a team isn't always, like, communicating as effectively as they should, or, maybe they need a system to I mean, I would get worse sometimes before anyone could read my chart, something new would be happening, so I needed my team to be more organized and more cohesive and come up with a plan. And they needed to do it together because when you have multiple organ failure or multiple systems, you have, like, so many specialists, and if they're working in a silo, it's really hard to make progress. And I had, luckily, one fetal maternal medicine doctor who heard me, took all of my doctors and put them on one communication chain, and they together came up with, like, sort of a strategy with how they would handle my care. Um, and from that moment forward, I that was the last time I was in the ICU. They were able to come up with a strategy because I would say I had very complex care, not only in different organs, but because, for example, I had a clotting disease and a bleeding disease. I also had, by that point, severe sepsis and pneumonia, but I needed an immunocompromising drug to survive. And so they had to figure out, like, "Okay, well, she can't die of sepsis. We can't keep giving her a drug and have her die of an infection." They were like, "Okay, we're gonna strategize now. Like, we're going to treat the infection, and then we're going to treat the underlying disease after she recovers from that. And they really developed a way of communicating that was much more productive and effective, thank goodness. And I think my survival is part of that journey.
What gave you the mental clarity to ask that in the middle of chaos?
I think I just started when I came out of my coma. It was like, and I don't know, maybe I'm not allowed to swear here, but I had no more F's to give. Like I was like practically dead at that point, right? And I was like, I'm just gonna say whatever it is I want to say at this point. And to be fair, they were really moved and uh like emotionally rooting for me, right? Like when I came out of that coma, like they were so excited that I was alive. So many of them were really truly like invested so much. And so I just was like at that point, I'm just like gonna say what I think and advocate from this position and because I need to get home to my baby. I cannot die right now. Like I'm not going anywhere. So I need you all to get on board. And I think just that sheer like, I don't know, there was no artifice anymore. Like what did I have to lose but my life? So I just, I came into my own and found my voice. They don't often have to work together quite as much as they did with me. Multidisciplinary care is really tricky, but it's so essential that they communicate with each other. And and often with my disease, the ongoing care involves a nephrologist and a hematologist. Like you need them both to work together to get the best possible care because the disease is so complex. It's so complex, they're actually thinking that it might actually not be one disease, but also like a series of diseases, sort of like cancer. There's many kinds of cancer, but it's all cancer. They're actually thinking that this disease might be kind of like that there's all these different versions of it. So it's very complicated, and no two people with aHUS are exactly like either. So you need more heads are better than one, frankly, also in healthcare. And if you can get them to work together, you have a really, really, I think, a stronger case for survival. It can be very, very hard. And I do think that I'm not sure how often doctors are, they have to work in teams themselves, but they're often used to being the boss of their team,
Yeah.
or they're a hospitalist in a system where they hand it off, but, you know, and they don't always agree. And that's still true, right? Uh,
Mhm.
in my ongoing care, even my doctors don't always agree, and I end up being the one that has to like weigh decisions and decide using what I would call shared decision making.
Mhm.
But I do think more heads are better than one, and if you can get a team that can work together, it can be really, really impactful and great for outcomes.
Mhm. Do you think patients are often afraid to speak up?
Yeah. I mean, I think we often feel out of our depth, um, because it's complicated, especially for me. I was like it took me, like, weeks to even figure out or understand how my disease even worked. But I think the thing we do know is our own experience, and we do know our own bodies. For example, there was a period when I was showing signs of uremia, but my labs were still in. a range that seemed stable to them, but to me, they were not. I was having a hard time. I was having some aphasia and having some difficulty, like seeing what was real. Like I was having some. Uh, I don't want to say them, call them hallucinations, but it was almost like my brain was skipping. Like I would see scenes happen again. Like if a nurse came in, sometimes I would see her come in another time. It was very confusing. They called it confusion, but I was like, this is deeper than just confusion. I'm literally seeing it happen again. And I remember trying to warn my doctors as like I was having these symptoms. And I get it. Like you can feel very uncertain, but I do think we know our bodies. And I often tell people you're the expert on you. You may not understand like what a protein is, but that doesn't mean you don't know your own experience or when something's not normal. And so don't be afraid to um, be part of the team and share your experience uh, because you and your experience are so important. You're an important piece of the puzzle.
What advice would you give to people who feel intimidated in medical settings?
I would say you're normal. Like that's very normal. But to also know that like it's okay to speak up. Always sort of speak up with uh I would say how do I put this? You don't want to like be they will label you a problem patient if you're aggressive or too angry. Like they're really like they're overworked and stressed, and as soon as you sort of push back in a negative way, it can be very difficult. But if you come from a place of what I would always say curiosity, asking questions, don't be never be afraid to ask a question. I always say like people ask questions, get answers. And so even if you feel uncertain about being in that space, or you feel like something's wrong with your body, you can always pose it as a question. Like, "Oh, I'm feeling this. What could be the reason for that?" Or, "Oh, this is new. What do you think it's part of what's happening?" Or posing it as a question can sometimes feel like a little less challenging to a medical team. But I think you have to contribute and also feel free to use your voice when you feel like you are feeling better or if something's working. Like you and your experience matter in the process. So I know it's scary, I know it's intimidating, but it is important to be a voice in the room.
Your background in comedy shape how you go to the ICU?
I mean, I mentioned before I was a project manager, so it was like able to I'm used to working with teams, and I
Mm.
can tell when a team isn't fully like talking to each other. So that helped for sure. But I think we all have backgrounds that can help us in these situations. It just um, in one way or another, our life experience can often inform us when we're put in a challenge.
How has humor become a survival strategy?
Oh yeah, I mean, I use humor a lot. They even put in my chart in the ICU, making jokes and you know, and I think sometimes they thought I was better than I was just because I was cracking a joke, but I sort of I was like, it's really funny. I've never been funnier than in on my deathbed. Like, you make a joke when you're dying, people laugh. Like, it's pretty funny how, like, every joke lands when you're almost dead. But I do think for me, like, if there's a joke to be made, I will make it. That's just my personality. Maybe it's because 'cause I'm Irish, I don't know. But, I think it's a way I see the world, I try to find the humor in situations. It doesn't mean I make light of the situation. It just means that humor is a way of coping. It's a way of seeing the world, and it's a way of trying to, I don't know, survive an unbearably scary situation. Like, if you can find humor in a dark place, you kind of take your control back in a strange way. So I always say, you know, if you can make a joke, if you're dying, make a joke because people will laugh.
What does it mean to hold both trauma and laughter at the same time?
For me, I think I've always been someone that does that. Um, and I would say I'm not alone. I mean, a lot of comedians have a dark side. That's that's the truth of it, right? We hear that all the time, right? And a lot of the funniest people I know have really been through a lot of hardship. And I think there is something about taking the scariest parts of us and being able to look, I mean, I think a lot of humor is both surprise and connection. Like, we find it funny because it either surprises us or it's like something we like deeply understand. And I think both of those things are very common in this like survival experience. Um, I also think I use humor to connect. I'm not making jokes by myself, in a room. Sometimes I'll think about one, but like, it'll make me laugh. But like, you know, with my team or with my husband, like it's just a way of taking back power in a situation. And honestly, it's a lot. It's very difficult when everything is really scary, right? Like,
Mhm.
if you can find a way to, you know, like like one of the things I would talk about is my dialysis machine, my constant dialysis machine. It sounded like it would say live or die, live or die, live or die,
Huh.
live or die, live or die. And I was like, I have to listen. It's like all I would hear from this machine. And then I mentioned it to the residents because I was like, Is it just me or does this sound like the machine is saying live or die?" And they were like, "Now we can't stop hearing it." They're like, "In the ICU, whenever we see this machine, that is what it sounds like. Live or die, live or," like, it was just like, and just like those kinds of observations, it's like both very truthful and really honest and raw. And like, if we don't just call out that situation, like in the ICU too, like I would try to distract myself and I didn't want to watch content that was like sad. I looked for a comedy, like I was like, I want something that isn't scary. So I ended up watching like Bill and Ted's Excellent Adventure. Like, when I thought I was scared I was gonna die, like I was like, yeah, I'll take a cute Keanu Reeves and a silly premise. Like, this is much, I don't know, nothing else felt right. I just wanted to lean into humor. It just felt like a cozy warm blanket.
How did becoming a mother and becoming chronically ill happen simultaneously?
I don't know, that's like a whole other episode. That is definitely, it's been a challenge. I think I had this like vision of what I had in mind for motherhood for me, and the reality did not match that. And it took a lot of therapy and postpartum and antidepressants and healing and patience and time. I mean, I couldn't even pick up my baby for a really long time, and holding her hurt. because of everything happening, like even just holding her for a long period of time was difficult. But and I'll always mourn that. I'm not going to pretend that I overcame that. I will mourn her early days for as long as I live, I think. I didn't get to have the mom and baby experience that everyone sort of gets when they have the baby, in a typical situation necessarily. But I'm atypical, and uh, I had to mourn the dream of it to also start to face the reality of it. And there's a lot of moms who are amazing moms who do this atypically, and it doesn't make them less amazing mothers. I sort of had to sort of reframe my ableism around that. And yeah, I would say, I don't think she feels like she missed anything. She's doing great and thriving. And for me, it was a process I had to sort of come to terms with. And I'm glad that I did. I think it's never easy, I think, being a mom. I think it's experience that no one's quite sure especially on the first round, like you don't know quite how you'll feel or how that will go. And I just had like a lot of extra challenges with that. But it really, I think, made me a better mom in the end. And that's something I don't think I didn't really anticipate that. Like just probably a more patient mom, we don't sweat the small stuff. She's got a different rhythm a bit. And I think I'm really proud of her in the end because she's a really friendly kid. Her first word was hi. We had a lot of caregivers and helpers, and they taught her how to love just as much as I did.
How has your understanding of strength changed?
Oh gosh. I don't think I think it changed my understanding of it for myself. I think I saw a lot of strong people doing amazing things, and I just didn't think that applied to me. Like, not that I didn't think I wasn't strong, but I just was like, "Oh, wow, I was really impressed by other people's abilities to overcome challenges." Um, and I just never thought that I would be one of those people, I just made it, 41 years pretty boring health-wise, being a supporter for other people. And I that's the framing I give for a lot of my patient advocacy is it's just reminding folks that the only difference between being a patient and not is really just luck. It's the luck of the draw, right? Uh, every person will be a patient at some point, and yes, there's different degrees of that, but it's an inevitability, not an if. And I think that's something that I realize that we're all going to face physical challenges, and just it's the luck of the draw, you know, about when.
What does adapting to disability look like in real life? Not inspiration, but logistics.
Yeah. I mean, well, first of all, I had to confront, not, as I mentioned, a ton of internalized ableism. Like I felt like I was a supporter, but it was really, really, really hard for me. I didn't want. I could. I couldn't. I was bad at it logistically. I was terrible at it. Um, down to the point where like I didn't get a placard. And here I was, I couldn't walk. And I just didn't do it. Like, and I was like, honestly, like I was terrible at that. Maybe I needed more support, but I just, when my first flight, I got, some, the personnel on the plane like threatened to kick me off because I was asking for accommodations. At that point, it was an invisible illness, so I had my port, but, it was hard to see, and I had been in the ER the day before, and I needed all these accommodations, and I did it. I tried to ask for them, and they did not give them to me, and then I got frustrated, and I didn't have a doctor's note because I was not good at this, and then they threatened to kick me off the plane. I'm holding a baby and they threatened to kick me off the plane. That's how bad it was. So I was bad at it logistically. Um, I'm getting better at it now. I've had different levels of healing. I live on this bridge between ability and disability. Like some days for me, I'm much better than others. Some days I need more support. And I think that living in a bit of a fluidity can be a challenge, and a challenge for me because sometimes I'm not good at preparing ahead of time. So it's a learning process. It's a learning process every day. But I hope to think I'm getting better at it. But, I have to say, I wish I were better skilled at that aspect of living with disease for sure. Still a, what do you call it? A work in progress.
What inspired your Substack, Rare Disease Scroll?
Well, actually, I started writing when I was on dialysis, actually. And that's when I started writing my book. And I just had a vision for it. And I had all this time. I don't know if everyone's familiar with dialysis, but it's almost like going on a plane. You get stuck to a machine and you can't like leave this chair for like 4 hours. And a lot of people sleep, but I had always had a hard time sleeping. So I needed to distract myself. And so I had the vision for this book, and I was just like, I'm going to write it in dialysis. But then I realized how long it took to get a book traditionally published. It was like, and I really wanted to like connect and help with people, share what I'd learned now. And that's what made me start the Substack, because I was like, oh, this is a much more direct way. I can write an article and immediately publish it and share it with folks if we want to. And it's been an amazing tool to connect with others and share my story, but also it has its own community, and I read such beautiful work by other folks. So if folks aren't on Substack, I really recommend getting on it. There's some beautiful work being done there, and it's a great community.
Why is storytelling important in rare disease awareness?
Oh, I just think storytelling it's so powerful. I mean, look, facts and figures have their place, but that doesn't change hearts and minds. And I think we have to use our stories to, I think, look, the patients in this country, whether it's rare disease or just being a patient, like maybe you don't have rare disease, maybe it's cancer or what have you. But in the rare disease space specifically, we're sort of shouting from the void, A lot of us, there's not a huge community behind our disease, so we kind of have to shout to make impact. And the best way to do that is, in my mind, through story. And our own stories have such richness and truth. And if we can get people to care hopefully we can continue to raise money for diagnostic tests and advocacy and all the things that rare disease patients need and are waiting for. Only 5% of rare diseases have a treatment. So I think, getting science is moving incredibly fast, and I'm really encouraged by what could happen in the next decade. But I think story will help us get there, at least just when it comes to funding.
What does your partnership with WebMD mean for patient visibility?
Yeah, I'm really thrilled to partner with them. I try to find ways to elevate rare stories, and at least, my disease in particular, but also just experience of living with a chronic rare illness. I think chronic disease is a really commonality. I think that's true, but I always try to weave in the rare realities when I can. We sort of collab on what we will talk about, and I'm always like, okay, well, let me try to like sneak in, all the rare stuff I really want to care about and want to get out there into the mainstream. So it's a collaboration for sure, but I do think rare stories, we're not that, I mean, in the aggregate, we're not that rare, right? Like each individual disease is rare, but there's a lot of us living with a rare illness. And so I think collectively together we could be a powerful force. And I'm just trying to be a voice in that.
Mm-hmm. For reference, 30 million people live with one of over 10,000 rare diseases. That's 1 in 10. The best evidence of this is Every Life Foundation's Rare Disease Week on Capitol Hill, which is this week. Every year, they fill four flights of stairs and counting with overflow for a picture. What do you hope your upcoming book will change?
A few things. My book is about a lot of things. I think there's a lot of things that are not rare, right? In the sense of being a patient, of a lot of women have issues also with childbirth and things like that. So those are like the commonalities, and then the rare experience on top of that. So I think by sharing my story in that way, it's a story of um, just one person who had an insane medical experience and survived it, and how that happened. I think is really powerful. How, and also like how I really like mentally survived it. Because it didn't just stop at this experience. Like, I got laid off after it. I had to like reframe my entire life. Like the sort of, again, the domino effect of this experience was huge. It changed my entire life trajectory. But I would say it took me from being a person who didn't have any ambitions outside my own like goals, and gave me a greater purpose. And I think that that was a really powerful experience for me, and I hope the book serves as like just a window into how that can happen for someone. I think sometimes when you're young and you're just sort of in your own silo, looking outside that experience was really powerful, at least for me. But also, I think it was absolutely a journey of being a patient and finding my footing in that experience, because I think that's a really hard thing. Being a patient is a skill, right? And I really wanted to take all the things I learned and just give them to everyone so they don't have to learn it the hard way.
How can people listening or watching support your work?
Yeah, please come see me on Substack. I would love, come say hi. I'm also on Instagram at Taylor Coffman Made and TikTok. Find me on TikTok, talking to the screen, trying to make this world a better place. Find me there. Come say hi. I think, um, supporting me in those places helps support an eventual book and all those good things. So please connect with me. And I want to hear other people's stories too. So, share your story with me, and I just want to help patients and help advocate for rare disease, and do what I can. And a lot of that is connecting with others and creating community, and that's really important to me.
Mm-hmm. Taylor, thank you for sharing not only your survival story, but your vulnerability, humor, and advocacy. Rare Disease Awareness Month reminds us that behind every diagnosis is a human being, and often a story of resilience that the world needs to hear. To our listeners, if today's episode resonated with you, please subscribe to A Rare Connection and share this episode with someone you know, someone who needs to hear it. This is both an audio and a video podcast, and it is on multiple platforms. If you're watching on YouTube on my channel, Rare Chef, comment below and let us know what stood out to you. If you're listening on audio, use to send me a text link in the show notes. You can also follow Rare Connection on X, LinkedIn, and Facebook. And as always, this episode it brings up feelings of overwhelm. Please know support is available. In the U.S., you can call or text 988 for the Suicide and Crisis Lifeline. You can also text home to 741-741 to connect with a trained crisis counselor. You are not alone, and your voice, it matters. Thank you.